Welcome to the Life After a Heart Attack or Heart Surgery podcast. This show delivers actionable strategies regarding heart health wellness, helps rebuild your confidence and manage health anxiety. Sally provides practical wellness tools for life after your event or diagnosis. If you want to learn how to move past the fear of what if and manage your energy so that you can live a full, happy life again, you're in the right place. And now your host, Sally Crawley.
Hello and welcome, my friend. Whether you've been with me for a while or this is your first time, it's great that you're with me. Today, I'm going to be talking about understanding Pumphead and the heart-brain connection after surgery. If you're listening to me, you've likely had and survived a major cardiac event and a complex surgery. You've been told that the surgery was a success, and by all clinical markers, you're mending. Yet inside, things still feel a bit off. Maybe you're struggling to find the right words in conversation. I'm always forgetting people's names, even if I've mentioned them a few moments before. Maybe you feel a strange sense of detachment from your loved ones, or an anxiety that doesn't seem to have a source. In the medical community, this is often called Post-Perfusion Syndrome, PPS for short. But more locally and amongst us hearties, we talk about it as being called Pumphead. And while traditional medicine looks at things like inflammation, blood flow, there's a perspective that looks at the heart and the brain as a unified electromagnetic system. And that's what I want to talk to you about today. We're going to explore the magnetic field theory of PPS, not as a replacement for medical science, but as a complementary to help you navigate your journey back to yourself. What is Pumphead? Before we dive into the energetic theories, let's acknowledge the physical reality. During a bypass surgery, a heart-lung machine takes over the work of your most vital organs. While these machines are life-saving miracles, they are not biological. The standard medical explanation for Pumphead symptoms includes microemboli, tiny bubbles or debris that can temporarily affect small blood vessels in the brain. Systemic inflammation, the body's alarm system reacting to the bypass machine. And thirdly, altered perfusion. That's the difference between the steady mechanical flow of a pump against the natural pulsatable beat of a human heart. Symptoms often include brain fog, memory lapses, irritability, and a general sense of being disconnected. For most, though, these fade within about 6 months, but the experience can be deeply unsettling and may last longer. So let's talk about the magnetic field theory. It suggests that Pumphead isn't just about blood and oxygen, it's about information and rhythm. The heart as an electrical powerhouse. Did you know that your heart is the most powerful generator of electromagnetic energy in your body? Its electrical field is about 60 times greater in amplitude than the brain's, and its magnetic field is up to 5,000 times stronger. This field isn't just contained in your chest, it can be measured several feet away from your body using sensitive instruments. In a healthy state, the brain and the heart are in constant communication. This isn't just through the nerves, but through electromagnetic entrainment. Like two grandfather clocks on the same wall that eventually swing in unison. The brain's rhythms tend to synchronize with the heart's powerful electromagnetic pulse. In magnetic field theory, the pause and the desynchronization is discussed. During bypass surgery, the heart is stopped. The natural rhythmic electromagnetic field of the body is essentially silenced, or replaced by the steady, non-pulsatable hum of the bypass machine. The theory suggests that when the heart is restarted, it doesn't always handshake with the brain perfectly right away. Imagine two high-speed computers trying to sync data after a power outage. If the timing is off, even by a millisecond, the data becomes garbled. This desynchronization between the heart's field and the brain's neural activity may be what manifests as that spaced out or disconnected feeling. But why does this theory resonate so much? While clinical trials are still catching up with the bioenergetic side of medicine, This theory provides a vital metaphor for healing. It validates the patient's experience that something deep inside feels out of sync. If we view Pumphead as a temporary loss of internal harmony, the goal of recovery becomes clear. We need to help the heart and the brain find their rhythm together again. Whether your symptoms are caused by microinflammation or electromagnetic desynchronization, or maybe a bit of both, the treatment remains focused on soothing the nervous system and encouraging coherence. Heart-brain coherence training, one of the most effective ways to resync these fields, is through heart rate variability, HRV training. The practice of this is using rhythmic heart-focused breathing, inhaling for 5 seconds, exhaling for 5 seconds, while focusing on a positive emotion like gratitude. The result of this creates a sine wave-like pattern in your heart rhythm, which naturally pulls the brain's electrical activity into alignment. It's essentially an alignment tool for your internal magnetic fields. If you want to add a little extra to this, you can put your hand to your heart and touch, as it helps activate the parasympathetic pathways and increase heart-brain coherence. All you need to do is place one hand on the heart and one hand on your tummy and breathe slowly, inhaling for 5, exhaling for 5, until both hands rise and fall in a shared rhythm. Another technique that you can use is called grounding. You might have heard it called earthing. If we consider that the body is an electrical system, then grounding becomes a literal necessity. Barefoot walking on natural surfaces. How to do it? Pop outside, spend some time walking barefoot on grass, sand or soil. And the theory behind this is that the earth has a natural negative electrical charge. Direct contact is thought to help discharge the static of a stressed nervous system and provide a baseline frequency for your body to settle into. Remember, barefoot, grass, sand or soil can help you feel more in your body. An alternative is to use gentle rhythmic movement. Slow rocking, swaying or micro movements help to regulate the limbic system and restore internal rhythm. You can sit or stand comfortably. Allow the body to sway naturally with your breath and keep the movements small and soothing. If you try it, let me know how you get on. And then there's cognitive rehabilitation. Treat your brain like a muscle in physiotherapy. Use puzzles and games, apps like Luminosity or simple crosswords to re-establish neural pathways. Then also you can apply the one task rule. To reduce the anxiety of brain fog, commit to doing only one thing at a time. Multitasking creates electrical noise and that can exacerbate the feelings of desynchronization. Have you thought about doing a heart-centered body scan? This is a somatic meditation that invites awareness to the chest area, helping you reconnect with the sense of your heart. Sit comfortably again or lay down and slowly scan your body from your feet to your head. Pause at the heart area and invite warmth, spaciousness, or simply notice sensations without judgment. This approach is widely used in therapy to reconnect the heart and mind. And this one is really a lovely idea. Using connection to restore internal rhythm. A lot of trauma-informed literature emphasises limbic resonance. Our nervous systems sync with others around us. You can use the quiet co-presence technique. Sitting in a room with a calm person or a pet can gently stabilise the heart field. Then there's the soft eye contact practice. A few seconds at a time, but never forced. Stare, or look rather than stare, into someone's eyes. Oxytocin releases support emotionally and physiology and creates unity. And for more ideas about Pumphead, you can read my previous article, which was called Pumphead, Is That a Thing? I hope you found that this podcast is really interesting and helpful for you. My message to leave you with today is the song returns. Recovery after heart surgery is not a straight line. It's a slow, rhythmic return to the world. If you feel out of sync, treat yourself with the same tenderness you would give a musical instrument that has been moved across the country. It needs time to adjust to the new temperature and to settle back into tune. Your heart is beating again. Your brain is processing. The magnetic field of who you are is still there. It's just finding its way back to a steady hum. Give yourself grace. Breathe into your heart. The rhythm will return. And one last thing before I go. Coming soon to this podcast, I'm honoured to have Andrew Pike as one of my guests. He's a leading light in the field of Pumphead. As a filmmaker and a heart surgery survivor who experienced Pumphead, he decided to share what it's all about by making a film. Pumphead, the film, is a feature-length documentary exploring patient experiences following a major heart surgery, how to understand these experiences and how to live with them. It's a story of existential crises and transformative experiences told by 8 ex-patients, including Andrew himself. If you pop down to the show notes or across to my website and find the article, there's a link that will take you through to a trailer so you can find out more. Thank you for listening today. Be kind to your heart and mind, and don't forget to subscribe so you don't miss the next episode. And let me just remind you, you are loved more than you will ever know. You're admired by more people than you'd ever expect. You are worthy of joy, happiness, and adoration. You are one of a kind, unique and priceless. You are the only one that can be you. Be proud, be bold, be you.
As we close today's episode, a quick but important reminder. This podcast is intended to support and complement your medical care, not replace it. Sally is not providing therapy, medical advice, diagnosis or treatment. If you have concerns about your heart, your health or any symptoms you're experiencing, please seek advice from your GP, cardiologist or emergency services immediately. Always listen to your body and always follow the guidance of your healthcare team. To get more from Sally, visit www.myheartandmind.co.uk.